All right, let's get started. I want to welcome everybody. I am Dr. Ruben Rakoba, a pediatrician from Pediatricians, and the moderator for tonight's live Q&A session, Your Child's Mental Health, How to Cope with COVID-19. Joining me on the panel tonight, we have four panelists, and if everybody can wave when I announce your name. The first up is Dr. Christiane Grunenwald from Wheaton Pediatrics. As you can see, advertising Wheaton Peds right on the wall behind her. She sees patients at both the Wheaton and Batavia offices. Also with us tonight, Dr. Anna Laufter from Fairview Pediatrics in Grays Lake. Denise Gardner, a pediatric psychologist from PCPA Chicago, who sees patients at our Elm Street Pediatrics location in Winnetka, and Annette Poppernick, a pediatric licensed clinical social worker, a therapist who sees patients at our Wheaton Pediatrics office. We had a lot of questions come in over the last few weeks from many of the registrants, and we'll try to get to as many of those as possible. But I want to point out that you also have the ability to send in questions live tonight, either on the chat function on the Zoom call, or for those of you on Facebook Live through that forum. So don't worry if you missed something during tonight's session, you can't take notes, or you had to attend to something and had to step away for a few minutes. We are recording this entire session, and it will be available to everybody. We will send out the link to the recording to everybody who registered for this event, and we'll also be putting it on both our website, pediatrust.com, and the website for the two therapists we have tonight, pcpachicago.com. We want to respect everyone's time, so we'll try to end the session promptly at 7 tonight. All right, let's get started. Dr. Laufter, this first question is for you. One parent wrote in earlier and wants to know if you can tell us what the short and long-term effects of remote learning are.
Well, I think that we do get a lot of questions about long-term e-learning that we don't necessarily know the answers to, but we know that there so far have been both positive and negative effects of remote learning. So in the short term, we do worry about decreased time actually spent learning, kids falling behind in their education, perhaps a lower quality education overall, the fact that their standardized test scores may not be as reliable as if they were in school learning. We do learn over time that both students and teachers can develop remote learning fatigue. Of course, social skills are impaired. Engagement can start to dip the longer we go through this, just pandemic fatigue in general, we're all experiencing it. And then over time, of course, noticing gaps for potentially low-income students or students with special needs who would benefit greatly by being in the classroom. However, positive effects that we have seen, remote learning is great to develop your technological skills and motivational skills, getting yourself learning and on the ball and developing new routines, or sticking with old routines but in a different way. Learning new resources to use with looking things up online, extended study time. And then also this can have a positive effect for foster and military families who may not be centered in one physical location for a long amount of time. So we are saying both. We tend to focus on the negative, but there are some positives as well.
Thank you for that, Anna. Now let's switch to Annette. Annette, one parent sent in this problem, quote, "My child hates school and appears headed for a breakdown or some mental illness," unquote. Now, to me, that sounds very, very concerning. What would you say to that parent?
Absolutely. Good evening, everyone. I would tell that parent that what your child is going through is absolutely normal. It's definitely frightening and frustrating to see your child struggle and not know how to help and not being able to change or control the situation. Many children are struggling with e-learning. But those struggles don't necessarily mean your child has a mental illness. It's rather something what we call adjustment, where having difficulty adjusting to a large situation. And COVID is something that we all have never experienced before March. It's something very new. We had never done this wild scale e-learning. Having to sit down without that daily interaction, even the little things, that's what's the most detrimental here. That's what I've been hearing from my patients. It's the little things, like you are walking down the hallway and you wave hi to your friend. You get to sit together on the bus, not having to worry about touching or being 6 feet apart. Eating at lunch close and not having to shout across the table, actually having a private conversation. So what can you do? Make it as normal as possible. Make a visual schedule for your child to see what their day looks like. One of my favorite things is getting a trainer to attach to your bike and having their bike set up right at their desk, and they can be sitting, learning, and getting some of that energy out. You can also go on Amazon and buy these little pedals and underneath, and you just literally sit and pedal. Get a yoga ball that's like chair and use that to provide some extra stimulation. Have fidgets. I love having this at my desk. It's a little unicorn, and I just love to show my patients it and just show that a stress ball and a fidget can go a really long way. Also encourage breaks. I did this today. I was looking at the screen for a long time. My eyes were getting tired. And I walked up and I just went to go pet my dog, and it was the best. So doing things like that, instead of looking at your phone, scrolling through Instagram, look out the window, play I Spy, say hi to someone. Just make it as lifelike as possible. Wear an outfit, not sweatpants, not pajamas. Only use your bed for sleep, because if we use our bed for, homework, video calls, video games, our brains think, oh, this is fun time, not sleep time. So do your best. There's no right or wrong answer here.
Thank you, Annette. Very wise advice. Denise, I have a question for you. How do we help our high schoolers who are feeling isolated and overwhelmed by learning online?
Certainly. Yeah. I think, there's a lot of different issues that I think come up during telehealth. And some of the things that I would recommend are things that'll touch on what Annette just mentioned. But I think definitely the idea of keeping some sense of structure and some sense of routine, right? We know it's not going to look exactly the same as it might have when kids were going to school, right? But things like regular wake up time, eating breakfast in the morning, getting themselves ready are all super important to just put them in the mindset of it's time for learning, right? It's so easy to sleep in late, roll out of bed and sit in front of the computer, and it's just not setting them up for success. I think similarly to what Annette said too, set that boundary between your personal space and your school space, right? Have a desk to work at, have a table to work at, right? When we try to learn from bed, not only are we tired and relaxed, but also if we're doing anything school related that's stressful in bed, and then later on we go to try to fall asleep, we're thinking about that big chemistry test that we have tomorrow rather than being able to relax. I think also similarly to what Annette said, kids are having a lot of screen fatigue, right? They're on the computer all day for school. They see their doctors online. They see their friends online, right? So I've been encouraging high school students especially to use their break time wisely. Get away from the screen, go pet your dog, get a drink, get some physical activity, step outside for a little bit, something that's not screen related. And then the last thing I would say is getting creative about ways you can interact with your friend. I've had some patients of mine who've set up little lunch groups that they do over Zoom so that when they log out of their classroom, they can at least look forward to seeing their friends on Zoom at lunch and just relax a little bit and talk about fun things. And also maybe doing something like a homework group or a study group where kids can see their friends and work on their homework and just have a bit more social interaction.
Thanks. Great advice. Thank you. Speaking of teenagers, Dr. Grunenwald, you've raised a few yourself. So this next question is for you. Quote, I see new depression and anxiety for the last 6 months since the start of COVID, which is not easing in my 16-year-old son. He won't see a therapist, unquote. What do you tell those parents?
Right. So as we've all been talking about this pandemic and quarantining, and a lot of teenagers have only just started going back to school hybrid, so they barely have been in school. So this has been really hard on everybody. And even teenagers who understand that we have to be flexible and the whys of why we have to socially isolate or distance and isolate, wear masks, it still can be really rough on kids. My concern would be the fact that these anxiety and depression symptoms that this parent has been seeing have been going on for so long and don't seem, their child doesn't seem to be adjusting well to this new change. And we know that this pandemic and the way we're doing school probably isn't going to get any better, probably the rest of this school year. I guess I would make sure that you try as best you can to connect with your child about how they're feeling, validate, empathize with them, that you understand and it's very normal to feel these feelings. But if their mood, their emotion is getting in the way of them enjoying things that they used to enjoy, or anxiety is getting in the way of them being able to do what they need to do and want to do in their life, then really talking to a therapist is the best first step. And I think explaining to them what that means is really important. I think kids don't have much of a concept about what therapy is or talking to a therapist is. And as you can tell already from the two therapists that we have in the webinar tonight, they're very personable, nice people that are easy to talk to and have great suggestions. So you can maybe explain to your kids what that would be like. In this time, most therapists are doing sessions through telemedicine, so your kids don't even have to leave the comfort and security of your own home, so they can do these visits online through telemedicine. If that still is not acceptable to them or they're very hesitant to do that, I would suggest making an appointment even with a primary care provider, your pediatrician, somebody that your kid maybe already knows and feels more comfortable with, and at least open that topic, talk about that with your primary care provider. We're all very well versed in depression, anxiety, even before this pandemic, but even more so now because we are seeing more of that. We can do screening tests or have your kids do screening questionnaires either online or email them to you, and that might make it more objective to your kid that yes, you really do score high on these questionnaires for anxiety and or depression. And we can discuss, again, the benefits of therapy and or possibly even medication if that's what's necessary for your child. But really, I think you got to connect with your kid first. Let them know that you're not afraid of this. You're there to help them and you totally understand, and it's can be very normal.
Thank you, Tian. We got a question that came in from a parent on the session tonight. Speaking of therapists, quote, our son has intense emotional outbursts and we took him to a therapist. The therapist, after 5 sessions, asked us to take him to a psychologist to find out what's triggering those. Should we find a psychiatrist or a clinical psychologist? Unquote. So I'm going to send this one to Denise Gardner, who is a psychologist. Denise, what advice do you have? What's the difference? Can you fill us in a little bit?
Absolutely. So a clinical psychologist is going to be someone who is a doctoral level provider who is trained in doing things like therapy or things like testing evaluations to help kids with things like emotion regulation or temper outbursts. So it's possible that the recommendation coming from the therapist was to see a psychologist to maybe do a more in-depth clinical interview or observation of the child. Or it's possible that they were recommending something like a formal testing evaluation where we might provide the child with different tasks or questions or things like that to kind of really see diagnostically what's going on here? What are some of the underlying factors? And besides creating that clarification, testing also helps us come up with very targeted recommendations. The role of a psychiatrist then, who's a medical doctor who has specific expertise in providing medications for kids who may need them for things like anxiety, depression, emotion regulation. That person would meet with the child and the parent and evaluate whether medication was something that was appropriate. So that's sort of the different roles and the different types of things that each provider could do. And PCPA is a practice that has therapists and clinical psychologists. We do therapy, and also during times when we don't have limitations due to COVID, we also do diagnostic testing as well. So those would be things that you could either ask your pediatrician about, or you could contact us at PCPA for more guidance.
And the contact information is in the chat. If everybody clicks on the chat function, the little button at the bottom of your screen, you can see the website to go to for Pediatricians that talks about behavioral health services, and the PCPA Chicago website as well. As somebody who's dealt with this both personally and professionally in my own family with teenagers, I can tell you that a psychiatrist is really necessary when you're really talking about either very complicated diagnoses, I'm not sure exactly what the diagnosis is, or more importantly, when medicines absolutely need to be involved, because only a psychiatrist can prescribe medicine. But the psychiatrist is not going to sit there and talk to your child, not going to delve into really what's at the root of this, not going to talk about what's maybe triggering some of these outbursts. That's not the psychiatrist's role, in my opinion. Most psychiatrists in the area don't do that. That's where the psychologist comes in, a therapist, like a licensed clinical social worker, like Annette, other kinds of therapists. So I do think that in that case, if you don't think there's medicine that needs to be involved for your child, it's probably best to start with a psychologist, a therapist of some sort. That's my 2 cents. All right. Let's go to Dr. Lofter. One parent told us, quote, "My 9-year-old recently chopped all his hair off on Columbus Day, a day off from school. Is this normal?" Unquote. Well, Anna, is it?
Yes or no. I think it could be just something that the child is doing to try something new. It could be a form of control in this situation we have where we don't feel like we have a lot of control in our lives. It's something that they can do. They may just be trying to shake it up and have fun. It may be something that they've seen on social media, since they're spending so much more time online nowadays. So you really have to ask your child, what was the reasoning for cutting off your hair? And if you are starting to see some changes in their activities of daily life, kind of what Dr. Grunenwald was referring to earlier, if you're starting to see mood changes or problems with relationships with family members or friends, or lack of things that they used to like to do, impact on their appetite or their sleep or their school performance, it may be time to discuss it with your pediatrician, get some of those objective mood questionnaires filled out, and see if there's possibly something below the surface that we're missing. It could be completely something benign, but as you're going to see as part of this panel, that communication with your child is going to be most important. So I would go from there.
Thanks a lot. I'm going to go back to Denise. There's a question sent to us, asked for tools that we can give to both the parents and perhaps to their children to cope with day-to-day issues that feels like never-ending disasters, COVID, school, upcoming election, global warming, murder hornets, you name it. The list goes on and on. 2020 has been a heck of a year. Yep. What tools can you suggest for parents, for themselves, and for their children?
Most definitely. Yep. I think we can all agree there's been a lot going on in 2020, and young people especially have a lot on their plates. And I think it's a time where a lot of kids and teens are really feeling a sense of grief, a sense of loss of control. And I think in those kinds of situations, it's really easy to focus on things out of your control, right? All these things piling up. But my biggest piece of advice is to focus on things you can control or things you can change. Big things to keep in mind are things like self-care. Now is a time that kids and parents need to be taking care of ourselves, right? We need to replenish our bank. We need to get good sleep. We need to eat good meals. We need to move our bodies. We need to go outside. We need to get as much of that sunlight as we can right now, right? Before we start having our shorter days. I think things like keeping as much of a routine or a schedule as you can. Right now, so many things are unpredictable, and I think keeping that predictability as much as you can is really helpful. Another thing I encourage a lot of for my patients is focusing on gratitude. I understand that now is a time where it may seem like there's not a lot to be grateful for, but even talking about or writing down 2 or 3 things a day that are you feel grateful for, whether they feel like big things or small things. I think also taking time to relax, doing things like yoga or checking out a relaxation app like Headspace are definitely things that I would recommend. And I think the last thing I'll say, just especially regarding our teen populations, is that I think with climate change and the social justice movements and the election, our teens are feeling like there's a lot out of their control because they're too young to vote or they feel like they're too young to make a big difference. And for all of those teens, I've really encouraged them to find ways of getting involved in a group they feel strongly about, or helping create a recycling program or composting program in their community, something that helps them feel like they're contributing and they can make a change.
Thank you. I'm going to broach an even more serious topic, if there is one, right now. Those of us who work in DuPage County know that the coroner recently came out with a report that noted that suicides were up over the last few months compared to the same time period last year. And COVID obviously plays a role in that, and that's been documented across the country as well. One parent sent in a question, wants to know how to help their teens who have a friend or classmate who has committed suicide. What resources are out there for teens who are going through this, or in fact may even be thinking about it themselves? Annette, you've dealt with this in your practice. What can you say to help that parent?
Absolutely. First off, the thing I want to echo the most is, as a parent, there's really nothing scarier than your child telling you, I'm thinking of ending my life. It's terrifying, so your fear and your worry are completely valid. Also, we want our children to know that even though we worry for them, we can handle this. I have had so many children and teens tell me, I don't want to worry my parents. I'm afraid that I'm a burden to them. I don't want them to freak out. So as much as you want to run to your child and hug them and never let them go, the first thing to say is, thank you so much for telling me. Because when someone tells you something that deep, they're really giving you a gift. And I tell my teens, your parents know when something's wrong. They're more worried when you don't tell them than if you do tell them. So remind your kids that it's okay to talk about. Suicidal thoughts can seem like a bad thing. And of course, they're not a happy thing, but we shouldn't label depression, anxiety as good or bad. It's just, it's a complex emotional state. We've got to address it. There's so much out there. If you don't feel comfortable going to your parents, going to a trusted adult, remind your kids, hey, if you don't want to talk to me, that's okay, but talk to your aunt, talk to your cousin, talk to someone you trust, talk to your coach, someone who's an adult who can help you. I also want to remind kids that there's some really nice hotlines out there. The suicide hotline is obviously the big one, and we'll post it, but it's 1-800-273-8255. There's also the text crisis line. I like that one a lot for teens because it's anonymous and you can text, and it takes away that pressure of, I'm going to be talking at 2 a.m. on my phone. So it's easy. You just text the word home, HOME, to 741-741. So I really would, if I could say one thing to a suicidal teenager out there, I would say someone will listen. Someone will listen, and we have to validate what that teen is going through. No matter how small or big something might seem, if it matters to you, that's enough.
Thank you. Those resources are on the chat box on the right. If you open up your chat function on the Zoom call, And we will include those resources in the email that goes out to all the registrants with the link to this recorded session later on in the week. Okay. All right. Dr. Lofter, we had a couple of questions, one in the chat tonight and one that was sent in by a parent earlier in the week about resilience. And one parent wrote, what is the single best thing we as parents could be doing to ensure that our children maintain or cultivate resilience?
I think listening to them and making sure that they know that their voice matters in all of this, even though they may feel like it doesn't. If just ask your child on a daily basis, how are you feeling? How are you managing this? And don't force an answer. I wouldn't just reassure them, everything's gonna be okay, everything's gonna be fine, before they answer. Make sure that their voices are heard. I would definitely keep a positive tone, try to celebrate anything that's positive throughout the day, keep their self-esteem up, make sure that they're still participating in activities and hobbies that make them feel good about themselves. I would make sure that everybody's expectations are also real and thus a little bit lower than we would like to have them, knowing that mistakes with technology are going to happen. We're going to get headaches from being on the computer. It's going to be tough, but knowing that they don't have to be perfect every day. It's a lot of pressure to put on them, and just keeping their goals realistic, I think, is really important. And then I would also make sure that encouraging social interaction, that they can stay connected with the people that matter to them outside of their families, is really, really important. But just making sure that you're checking in with them is really important.
Thank you. All right. Dr. Grunewald, one parent has asked how much bending of the rules should be allowed when a child is acting rude and disrespectful to other family members during this difficult time.
Right. So, again, it's speaking to what Dr. Lofter was just saying, right? This is a tough time, and we're not going to be perfect. Everybody's going to have a bad day where we fly off the handle and get angry. And our homes are and should be safe spaces for our kids where they can be themselves, or they can release some frustration. So I would say, I think in context, you should allow some slack. However, that being said, if this is a chronic problem or becoming more of a recurrent problem, I think you got to maybe dig a little deeper and see maybe if there's a particular problem or issue that has been really building up frustration in your child. And depends on the age of your child as to what your expectations might be as well. My other thought on that issue is that, families have been spending way more time together than usual. And maybe sometimes that gets a little old or frustrating. So maybe a little more fighting between siblings, or fighting between parents and kids, all that kind of stuff. So try to make time to do things with your kids and come together as a family in a fun way, if you can. When my kids were younger, we would try at the dinner table to have everybody go around in a circle and say one thing that they liked about the person to their right, and then one thing they liked about the person to their left, as a way to think positive about your siblings when sometimes that's not your first thought. When your kids are older, maybe have each kid get to pick one night a week or once a week, like some activity that you can do together as a family, whether it's a movie that everybody comes together for, or some other type of outing, picking where you get your carry-out food from or something like that. But make it fun, give them something maybe to look forward to doing together as a family, and maybe that will help as well.
Thanks, Dan. Those are really good points. I don't think I could adopt all those if I asked my kids to look to their left and right and say what they liked. We might be sitting there for a very long time. That might be a long pause, but I'm glad it worked for you. All right, Denise, one parent asked, how do you identify mental health issues in little kids, like ages 4 to 7?
Yeah, I think that some of the things you might think about with things like anxiety or depression in younger kids are going to be similar to what they would be in older kids. Things like being a little bit more withdrawn, spending more time alone, seeming fearful about certain types of situations. But I would say one of the biggest things that differentiates mental health issues in that younger age group is regressions in different areas. So, for example, if it's a child that was previously sleeping alone in their bed, it may be that they ask you to spend a little bit longer tucking them in, or it may be that they're getting out of their bed at night and they're asking to sleep in your bed. It may be a kid who previously you dropped them off at school and they gave you a quick wave and they were into their classroom having fun, and now they're want to hold your hand a little bit longer, or they're tearful at drop off, or they don't want to go to school that day. Also things like toilet training. So kids that were previously toilet trained, maybe having urine or soiling accidents. So I think the biggest thing is regression in those areas. And another thing to keep in mind for younger kids who are depressed is that more often than not, it shows up as something like irritability or anger rather than something like seeming down or blue.
Thanks. Okay, Annette, we've talked a little bit about depression, obviously, tonight, but what about anxiety? One parent was asking, what are the warning signs that they should be on the lookout for regarding anxiety in their children, and any tips on how to calm anxiety if they do see that?
Absolutely. So there's a variety of different warning signs. Not every child is going to present with the same ones. And like I tell families, everyone feels anxiety. Anxiety is an emotion. When we start to feel it more often than not, and it interferes with our day-to-day life, our functioning, that's when it becomes a problem. So there are things like your basic stomach ache and headache. These are things that you and I know we feel because we're adults and we understand that, oh, I'm stressed, man. I'm tired. My eyes are tired. I have stomach ache. I don't want to do that presentation tomorrow. Whatever you're thinking. It's a big presentation for work, et cetera, et cetera. Children are the same way. They have a stomach ache because they have a presentation at school the next day. They've been doing e-learning. So anxiety can manifest like that. Why? Because your body's connected. Your body's a house, and it houses your brain, your thoughts, and your heart, your emotions. So if something's not right in one area, your other area is going to say something. Now, also, so like Denise was saying, irritability is very common. Kids might feel anxious, but it comes off as, don't talk to me, don't bother me. They're not mad at you, they're anxious. They also avoid a lot. Because honestly, if we don't want to do something, if we're afraid of something, why would you want to do it? Of course, it's natural to avoid that. Don't get me near there. So avoiding typical things, whether they avoided them before or it's something new. Isolated behaviors. It is so common for when we get down, when we get really, really anxious, to kind of keep to ourselves, especially if we're socially anxious. We will internalize our fears to be facts, right? I feel, everyone was calling me ugly today. That's a fear, but to them, it might be the reality. Reduced socialization is a big one too. Obviously, right now, we're not socializing as much, but it can be things like not video calling as much, not playing Xbox Live, just playing Xbox by yourself. And then a change of appetite and sleep. Some kids overeat, some kids undereat, some are waking up in the middle of the night. And then difficulty focusing, because if you're really nervous and someone's asking you to finish a math problem, you're not going to be able to because you're so nervous. So there's so many different tools that we can use. If we're building a house, we have to have a hammer and nails. If you're tackling anxiety, you have to have your coping skills, coping tools. So there's just different things you can do. There's no right or wrong here, but there are things that are comforting. Weighted blankets, doing our deep breathing, guided meditations, which are super great for sleep because you get to listen to something, your brain gets busy, but you don't have to just sit there and count sheep. Being able to talk to someone is crucial. Being able to socialize with other people. Facing our fears, reminding kids that you face your fears every day too. Simple comforting things like a warm bath, hot tea, fidgets, even like doing things like, let's say you're really anxious about a test and you're about to take a test, go jump rope for a few seconds. It really pumps you up, gets some of that adrenaline going, and it helps you refocus again. So there's no right or wrong here, but it's trying different things and finding the coping skill that works for you and your family or your child.
Sorry, I was muted. I would agree with all of that. And I would liken this to the maneuvers that we often give for colic. When I tell parents, there's 6 or 7 or 8 things that you can do for colic. Not a single one of them is going to work for longer than 5 minutes. But you do one, and then you do another, and then you do another, and then you do another. And pretty soon you can get through the hour or two, hopefully, and the child calms down. Same thing with anxiety. One thing in itself won't always work, I found with patients, but if they have several tools in their toolbox, they can, go from one to the next, and hopefully that'll help. So thank you for that advice. Dr. Lofter, we have several questions all related to around the same topic. One parent said, my son is furious to not be involved with his friends who do not practice masking or social distancing. He's a type 1 diabetic and understands his additional risk, but at 14, just wants to be with his friends. The friends' moms are not helping to be creative or promote outside activities or safety. Another mom wrote, my 14-year-old is allowed to go outside a couple days a week, but has to be outside and wear a mask if close. Not sure what options we have as it gets cold. And I'm going to remind everyone, it snowed yesterday, so it's coming. And another mom or another parent wrote to us a very simple question: how safe are unmasked indoor gatherings for teens? So that's a lot there to digest. But what can you tell us about the real risks for teens in these settings? And what advice do you have for parents whose teens are understandably very angry or frustrated with the state of affairs?
Well, I think that everybody knows the truth of the situation, and that is that unmasked gatherings are still, unfortunately, unsafe. We're 7 months in, and we're still struggling, and largely because these unmasked gatherings are still occurring. I think it's really, really important that parents especially are setting good examples for their children, and social distancing, washing their hands, and masking, not doing anything irresponsible. I know with the holidays coming, we're going to get a lot of questions about this. And of course, I don't ever want to tell people that they can't see their families, but masking is going to have to be the new normal. I know that that's always hard to adopt. Many of my patients think it's strange when I tell them that if I do get together with family, that we mask. If we are inside, we only unmask when we're eating, and sometimes we don't even eat at the same table. We kind of just eat and walk, or we're kind of positioned around the house in different places. People say, really? And I said, yeah, we've been doing that for a while, and we've been lucking out that everybody's been staying safe. So I think that for your son, unfortunately, he's going to probably run into this again and again, but it can start with the parents speaking to their kids about how important it is for your son. I'm sure many of these kids don't really understand the consequences of being ill as a type 1 diabetic, but that if his friends are unwilling to mask, really have to keep everything virtual. The CDC did update their guidelines this week that a positive exposure is an unmasked encounter with somebody within 6 feet for 15 minutes in a 24-hour period. So not just in a 15-minute block of time. So I'm sure kids before thought, they could stop at somebody's house, hang out for 15 minutes and maybe put their masks on and then take them off again. And, but really you have to keep them on. And to get out of this, everyone's just going to have to adapt to this new normal.
So many of you read the newspapers, and you've probably been reading about the surge that we're seeing in our area, which has prompted the governor to impose more restrictions. So we're actually kind of going backwards. And this was somewhat predicted when the weather got colder. And that's what we're seeing. So it's pretty obvious that what's driving this most recent surge over the last few weeks is not schools. It's not the reopening of schools. It's not congregating in bars and restaurants despite the governor's restrictions. It's not airline travel. It's really smaller, more informal get-togethers in homes, birthday parties, a bunch of kids getting together, a bunch of adults getting together, 5, 6, 7, 8, 10, not large crowds of people, but bigger than your immediate family and people outside of your immediate family getting together in homes, often not wearing masks, often not social distancing. And those are the exact types of gatherings that are very common over the holidays. So it's real. That's what's driving this surge. And the other thing is not only are numbers going up, but hospitals are filling up. I know Central DuPage Hospital, which tells us every day, those of us on staff, how many they have. The numbers are going up and up and up, and numbers we haven't seen since the height of the pandemic earlier in the year. And ICUs are getting filled up. So those are worrisome signs. It's not just we're testing more and people are more positive. These are sick, they're sick people out there. Now, again, most of them are not teenagers, but the teenagers who do these sorts of activities then get together with their families, their grandparents, and that's how this spreads. So the message is you gotta reinforce with all of your teens, all of your kids, that this is a real disease. It can be very serious for certain people, and everybody still needs to be as cautious as possible. And you need to do what's right for your family, even if other parents, other kids aren't doing the right thing. So you just got to stick with it. All right. Let's see. I have a question for Dr. Grunenwald. One mom wrote in, speaking of those with underlying conditions, should my 10-year-old with asthma continue in-person schooling, or should they switch her to e-learning this winter?
Okay, so, asthma is a respiratory condition, and we all know that COVID-19 primarily is or can be a respiratory illness, and that the people that are getting the sickest with this are oftentimes because of respiratory compromise. However, asthma can be and should be in most people a well-controlled chronic disease. And so just like the way I talk about asthma with kids out of pandemic times, kids with asthma should be able to participate in sports just like any other child. Their asthma should be hopefully well controlled enough that it doesn't affect their ability to participate in sports. So I would hope that we would have your child's asthma under good enough control that that even if they did get sick, let's say in previous winters with something like influenza or just other bad viral illnesses, that they would be able to, get through that illness without too much of a flare-up of their asthma. So I would say a really important thing would be to make sure that you've been in touch with your pediatrician, maybe at least within the past few months, to go over your child's asthma care. What medication should they be on or taking on a daily basis if necessary? Some kids only need to take a rescue medication when they actually, their symptoms are triggered, for instance, either from exercise or from oftentimes a viral illness. But some kids need to be on a daily controller medication, and it would be really important to make sure that if your child has that kind of asthma that they need to be on a daily controller medicine, that they're, that you have that prescription filled, that your child, if they're old enough that they're doing their medications on their own, check in with your child. Are they consistently using their preventative asthma inhaler 2 times a day, which most of them are? Again, we can do these visits through telemedicine. You don't need to be coming into the office. We can go over, there's something called an asthma control test, which is really another questionnaire that helps us get a sense of how well controlled over the previous 4 weeks has your child's asthma been. And it'll help us know whether we need to up their medication, put them on a preventative medication, or what have you. So I would say, I think if your child's asthma is well controlled, I think most people should be able to stay in person school. But again, you do need to just look at your family's context and what's going on, what kind of triggers your child has had in the past. And especially if they go to a specialist for their asthma, an asthma allergy specialist, check in with that physician as well and make sure that they recommend them being in person school.
Thank you for that. And again, there's, as we mentioned, most kids do quite well if they do get COVID. We're seeing, very, very few serious infections. In fact, I think in the 70,000 lives that Pediatrician covers, we've had many who have turned positive for COVID, but no hospitalizations. And we do see a lot of kids with special needs. So people are being very careful out there. So if you have a child with special health care needs, it's very important to, really do what you can to protect them. All right, Anna, there was a follow-up question. And I don't know that there's an actual definitive answer to this, but I do want to address it since it was brought up. One of the parents on the Zoom chat asked, how many kids should be allowed to visit together in one home for a safe visit? I'm pretty sure you don't have a definitive number, 3.5 or something, but what's your advice?
I think I'm going to sound like a broken record. I think it depends what activities they're doing. How, are they planning on wearing masks? I wouldn't have any get-togethers if they weren't planning on wearing masks. If they are able to social distance with activities more than 6 feet apart, like playing baseball in the backyard, or something like that, they could take the risk of taking their mask off. But in general, I'd say as long as they're able to wash their hands frequently, wear their masks, practice social distancing, then they should be able to see who they can. I just don't think I can put a specific number on it. If you have 2 kids, but they're, talking a couple inches from each other's faces and laughing and unmasked, then that's unsafe. So it just really depends on what measures they're taking.
Thanks. Okay. We're going to get to 2 questions before we finish. And this one is going to go to both of the therapists, Denise and Annette. We've talked about how important it is to keep kids safe, and some parents on the call are doing exactly that. But again, as a follow-up question, my daughter understands to not join her friends and not following the guidelines, and she understands that, but she feels left out from her friends. What do you say to her when she can't see her friends and the weather's getting colder and it's harder to stay indoors?
I feel for her 100%. I've been trying to find as many virtual groups as possible, get creative. Wheaton Public Library offers an anime club, a Minecraft club, a book club. The Wheaton Park District offers so many activities. If you look, there is so much out there. I found the DuPage Art Alliance, something like that. They offer virtual groups. So you pick up the materials, drive by, pick them up, and then everyone's connected virtually. It's like you're in person. So get really creative at home, get creative, doing scavenger hunt, relay races. If you don't have siblings, try to connect virtually as much as possible. There are ways to connect. We just have to find them. And remind your children, it's not if, but when COVID ends. COVID is going to end. We just don't know when right now, but remind them there is an end point.
I think the other thing that I would add is I don't think anybody's saying you cannot get together with anybody. I mean, right? Some of these kids go to school, right? So they're around a lot of other kids. It's just we got to be safe. So if you have kids come over, don't invite 20, invite 3 or 4. Take the cars out of the garage, put a space heater in there, so that the kids can just sit socially distanced, or with the mask on, or both. In a warmer environment, somewhat warmer, put on a coat, sitting on some lawn chairs or some car chairs in a circle, 6 feet apart if possible, with a mask on, and do something. There's all kinds of games that you can play using your phone or something else where you don't have to be right around a single table. And if 2 or 3 of your kids' friends have been sort of around them at school and over the last 6 months, then, that's sort of like your own little pod. So 2 or 3 friends can come over, again, wearing the mask, trying to do social distancing. I will point out, as somebody pointed out in the chat box, when you take off the mask and eat, that's a high risk sort of situation. So you should really only be doing that with your immediate family. Singing, talking without your mask even, laughing, those are all things that will spread the germs even more. So I'm not saying you can't laugh. What I'm saying is if they're going to come over, have them wear the mask all the time and really try not to take it off. So we're not saying they can't have any social interaction. It's just, it's got to be limited, smaller numbers, spread out, be a little bit more creative. And yeah, the cold weather stinks, but again, it's not January yet. So a space heater in the garage might give you another option, something like that. All right, this last question is, we've been sort of circling around it, and I'm going to want everybody to pitch in with an answer if they can. And that is, what is the bigger risk? COVID-19 as a disease, or the lack of social interaction and development? I don't know that there's a definitive answer to that, but I'd like to get everybody's opinion. We're going to start with Dr. Grunenwald, and we'll just go around the horn. Tien?
Yeah. That's a great question. And again, like you said, I don't think there's a right or wrong answer because all people, all children are different. I saw several preschool age children today in the office and was asked that exact same question about should they be in preschool or not, and are we concerned? I think your child best. So I'm going to address like those younger children where you're worried more about them learning, needing social interaction for learning social skills and that kind of stuff. I think your child best. If your child has siblings, you haven't had concerns in the past, they seem, pretty typical socially, they don't seem like they're regressing, that kind of stuff, then I think I'm not as concerned about that child missing a year of preschool. And I think they'll probably do fine then the next year. But if you have a kiddo that you feel like you have concerns that they seem like they're either regressing and getting more clingy to you, or maybe, not able to play with their own siblings very well, or, what have you, your kids best. If you feel like they can benefit from more social interaction, I'll tell you, I've been amazed when the kids I've seen in our office as young as, honestly, even 2 and for sure 3 years old and up, they have adapted to wearing masks beautifully. I think kids are always more flexible and adaptable than we give them credit for. And I think a lot of the kids I've seen that are in preschool, even daycares where they're there all day, do well. And like Dr. Kober probably said at the beginning of this, I don't really think it's the schools and preschools and daycares that are big spreaders of COVID, even in kids that we've had that have been positive, most likely because of a home exposure. So, I think if you feel like it's best for your family, for your child, your younger child, to be in preschool and school, I think there are safe ways of doing that, and it's being done for the most part.
Anna?
I would just like to echo exactly what Dr. Grunenwald said. I think that kids are incredibly resilient. And even if they do miss out on a certain amount of time of daycare, preschool, the steady play dates they had before COVID, they'll bounce back. And I believe they'll end up, coinciding with where they were before, that it can be made up. So it really is something that has to be individualized on the child, also individualized on the family's needs. I personally have 2.5-year-old twins in daycare 3 days a week. And I remember just kind of crossing my fingers when school reopened this summer with masking, and it's amazing. They are able to actually mask all day except for nap and lunch, and they love washing their hands, and we haven't even had a runny nose. So we do keep our out of school get-togethers, very limited. But as I've mentioned, we continue the same measures at home, same measures in the neighborhood, and so far so good. So I really do want to stress to people that you do have to do what is best for your family. But if you feel that keeping your child out of school, out of activities, presumably temporarily, until 2021 at least, I think that your child will come out of it unscathed. They'll be okay.
Thanks. Annette?
Short and sweet, I would just like to say the answer is what gives you peace of mind. There is no right or wrong answer, but you have to be able to make a decision and know that you're going to be able to sit with that. If it gives you so much anxiety that your child is at school or at home, there's no point in doing one or the other because you're going to be so anxious. Pick the choice that is right for your family, and everything else will fall into place. If you send them to school, you'll find ways to keep them safe. If you keep them home, you'll find ways to help them socialize. You have to take the necessary steps you need to for your family, and that's your right answer.
Agree. Denise?
Yeah, I'll touch on the idea of resilience again. I think that, there's no ideal circumstance here, right? Parents are having to make really tough decisions, and there's a lot that goes into it. And what we do know, as has been mentioned before, kids are resilient. They are going through a lot of adjustments right now, and there are going to be effects on their social, emotional, academic development, probably for every kid at every age. But we know kids are resilient, and we know we have tools to help them, can booster and foster that resilience. And we know that we have teams, we have pediatricians and therapists and psychologists and teachers and coaches that are all working together to help with that. So I just wanted to remind about that idea of resilience.
Thank you. Okay, I fibbed. I said that was going to be our last question, but there was one more that came in on the chat, and I do want to address it. It should be very quick. I'm going to send this back to Denise. The question was, you discussed how to identify mental health concerns with little kids. What about what strategies do you recommend to help them?
Sure. Yeah. So I think things to remember in that preschool age and that early school age are that kids are still going through a period of really emotional development. They're still learning to recognize emotions, label emotions, verbalize emotions. They're learning to connect that physical feeling of an emotion, like a racing heart, to feeling stressed or anxious or worried about something. So I think a big thing we can do with kids in that age group is help foster that emotional development, help them recognize and label emotions and understand how they react to certain emotions. I think a big part of the thing at that age too is parent modeling, right? Talk through some of your emotions with them, right? Oh man, there's so much traffic right now. I'm just feeling so angry that we're going to be late to the meeting or whatever it is. Obviously, we want to do this appropriately, but being able to talk about emotion words and being able to say something like, oh, I'm so frustrated right now. I think I'm going to take a couple deep breaths and try to calm down, right? So model that verbalization, the labeling, model appropriate coping. Even you staying kind of calm and cool in those situations models to them that it's possible to stay calm and to cope with difficult situations. And then, of course, beyond tools that you can use at home, I would recommend also, if you feel like this is an issue that your child could use extra help in teaching with, connect them with a therapist or a psychologist that can work with them maybe on a little bit more of a deeper level on those issues.
Thanks. That is great advice. All right. So we ran a little over, but it is time to wrap up now. So I want to thank everybody for joining us. I want to especially thank our panelists tonight. You guys gave great advice, and obviously based on the feedback that I'm seeing on the chat group, something that was very needed and appreciated by our guests. I want to remind everyone that we are going to be sending out an email link to this recorded session with all of the resources that were listed in the chat and discussed during the conversation as part of that email. And you might want to stay tuned for our next live Q&A, Ask the Pediatrician session, which is going to be sometime in November. And it's really going to cover about how to have a safe holiday gathering in the time of this pandemic. So some of the stuff that we talked about tonight will be reiterated there. But again, that may be 3 weeks from now. So who knows what's going to happen then. So be sure to look for the announcement on our website or in our social media posts about that session. Again, thanks to all of our panelists. You guys were all great tonight. And thanks to all of our guests. And I hope everybody stays healthy. Wash your hands, wear your mask, and social distance. Thanks. Bye-bye.
Thank you.
Thank you, everyone.
Woohoo!